So what's your experience been with Moxi?
I've used moxetumomab mainly on clinical trial basis, and not only in hairy cell, we also conducted a small trial of moxetumomab in relapsed adult acute lymphoblastic leukemia. As you mentioned, there are many nuances about using this drug that you have to be aware and able to manage, particularly, as you mentioned, capillary leak syndrome and hemolytic uremic syndrome. But with appropriate therapy, this drug can be useful and effective. And as you know, the current indication is for a patient who has had 2 prior lines of therapy, of which one has to have been a nucleoside analog. With that, what is your recommendation on how to use this drug at one point of management of patients with hairy cell?
So I think that in the third line and greater setting, I think I would use this drug preferentially before splenectomy. We found that the responses were better in patients who had not had prior splenectomy. And I would also avoid patients who have massive lymphadenopathy. That tends to be less easy to treat with Moxi. But we've been able to successfully treat patients who have very severe cytopenias, and because we don't tend to see worsening in cytopenias. And so I think that it works well in patients who've had prior purine analogs, and they tend to be cytopenic, but don't have an overwhelming burden of disease, because there is what we call a binding site barrier. There's a lot of CD22 on the cells. We're not giving that many molecules of Moxi, and so Moxi can be all bound up the first few cycles, and the amount that's in the blood is very low, and the amount that can really get covered by the tumor, all the tumor cells may not get access to the Moxi if there's so much disease. In that vein, I would just mention that we're actually starting a trial now of Moxi plus rituximab in patients with at least second-line need for treatment in hairy cell leukemia. But currently, the approved indication for Moxi is at least in the third line.
I think in summary, there are now a number of different options available for particularly patients who relapse after initial therapy. And I think my advice to the community oncologist is that there are a number of centers that see these patients and have clinical trials for these patients, and who are very willing to cooperate and collaborate with you in selecting and administering the best therapy for patients with hairy cell leukemia. And a good resource is the Hairy Cell Leukemia Foundation. And I think with this, we will continue to make further advances in treating patients with hairy cell leukemia, and hopefully there will be a time in the future where we will not even have relapses. Thank you.
Yeah, I think that I agree. I think that that patients with hairy cell leukemia don't necessarily need to be treated by a hairy cell expert, but I think they should get the advice of a hairy cell expert these days, because it's very critical now, because we have so many different treatments, and it's very hard for a general oncologist to decide on the right treatment. But I think once a patient does get an opinion, it's certainly possible for a general oncologist to treat the patient. But the other thing I would say is that clinical trials are also very important for patients with hairy cell leukemia. There's a international hairy cell registry that patients should be encouraged to contribute to because it's not a very common disease, and with more data, we can make improvements in the future treatment of hairy cell leukemia.